Hi everyone, welcome to Crystal Ned. Today we are making anatomy super easy by learning about the external carotid artery and its 8 branches. We will also use a fun mnemonic. The mnemonic is some angry lady figured out PMS. Some angry lady figured out PMS to remember them in order. By the end of this video, you never forget these branches again. First, a quick overview. The external carotid artery, it arises from the common carotid artery at the level of the thyroid cartilage. Now, unlike the internal carotid artery, which mainly supplies the brain, what the external carotid artery does is to supply the face, the scalp, the oral cavity, and parts of the neck. Now, along its paths, this external carotid artery gives off 8 branches that we can memorize easily. Now, to make remembering these branches easier, we will use the mnemonic some angry lady figured out PMS. From angry lady figured out PMS. Now, each letter represents a branch going from inferior to superior. That is when you're moving from bottom to top along the artery. The superior thyroid artery stands for S. S stands for the superior thyroid artery. This first branch is the superior thyroid artery and it supplies the thyroid gland, the larynx, and nearby muscle. Next is A, ascending pharyngeal artery. This ascending pharyngeal artery supplies the pharynx, the prevertebral muscles, and meninges. The L stands for lingual artery. The lingual artery supplies the tongue. F stands for facial artery, which supplies the face, the lips, nose, and cheeks. O stands for occipital artery, and this occipital artery what it does is to go backward. It goes backwards to supply the posterior scalp and neck muscle. While the P stands for posterior auricular artery. This posterior auricular artery runs behind the ear, while supplying the scalp above and behind it. While M stands for maxillary artery and it supplies the deep facial structures like the upper jaw, the teeth, the nasal cavity, and the meninges. S stands for the superior temporal artery, and the superior temporal artery ascends in front of the ear and supplies the temporal region of the scalp. A quick clinical tip: knowing the branches of the external carotid artery is essential in surgery, artery cannulation, and avoiding inadvertent injury during thyroid or facial procedure. And that is it. We have learned the external carotid artery and its 8 branches using the mnemonic some angry lady figured out PMS. And remember that the branches go from inferior to superior. If you found this helpful, like, subscribe, and share with your study group. Thanks for watching and see you in the next anatomical session. Thank you.